Hello everyone, welcome to the first webinar sponsored by Clean Fed and Nurtured on July 9th, 2013. I'm Ann Jimerson, the Senior Specialist in Behavior Change with Alive and Thrive at FHI 360, and I'll be facilitating this webinar. Today's webinar features a conversation with Dr. Marie Ruel on the importance of cross-sectoral collaboration for improved child growth and development. After my introduction, Dr. Ruel will present for about 20 minutes, and then we'll open up for question and answer and discussion. First, a bit about Clean Fed and Nurtured. We are a global community of practice that brings together the sectors of WASH, nutrition, and ECD, or early childhood development, to promote child growth and development. This is only our second event. We held an initial consultative meeting on May 2nd and 3rd of this year. Co-sponsors of that event and members of the ongoing planning group for Clean Fed and Nurtured are the WASH Plus Project, the Global Public-Private Partnership for Hand Washing, Alive and Thrive, and Save the Children. The past couple months have seen increased attention on nutrition during the 1,000-day period from pregnancy through the child's second birthday. In relation to this spring's G8 meeting, world leaders made a commitment to reaching the benchmarks established in the Global Nutrition for Growth Compact. And in June 2013, Lancet launched a series on maternal and child nutrition. This webinar builds on that momentum to continue the conversation about Clean Fed and Nurtured. Dr. Marie Ruel is lead author of one of the Lancet Series papers titled Nutrition Sensitive Interventions and Programs, How Can They Help to Accelerate Progress in Improving Maternal and Child Nutrition? Marie is Division Director for IFPRI's Poverty, Health, and Nutrition Division. IFPRI is the International Food Policy Research Institute. We're honored to have her talk with us today. Welcome, Marie.
Just to get right into the topic, paper 3 of the Lancet series, and I assume you've all heard of the Lancet series that was launched in June this year, which includes 4 papers, and the third one is about nutrition-sensitive interventions and programs. This is the second of a series on maternal and child nutrition. The first one was in 2008, and in the first one there was no chapter dedicated to nutrition-sensitive interventions. The terminology was not even invented, so to speak, although lots of programming was done that had some nutrition-sensitive approaches. But this is a relatively new topic, and it took a lot of digging to try to conceptualize it properly. The Sun movement had helped a lot in that sense. But we still had quite a bit of work to do, including defining what we mean by nutrition sensitive versus nutrition specific. And I will get to these topics. What I will do is present a very broad overview of some of the key issues and messages of paper 3 of the series, with the focus on how this is relevant for the nurtured community of practice, therefore focusing on nutrition, early child development, and water and sanitation interactions. Here is the second slide. So the new Lancet series has redefined slightly its conceptual framework, and I just wanted to point out at a few of the main changes, if you want. First of all, we wanted to, instead of having an outcome of malnutrition and looking at the determinants of malnutrition, we wanted a positive outcome, good nutrition. We also wanted to incorporate good fetal as well as child nutrition, and also incorporate child development. So this is one of the changes. We still have the 3 pillars: food, health, and care, and we look at the determinants of good nutrition at the same levels as before, the direct determinants as well as the underlying determinants. And you note here that we also look at or put in the model the long-term benefits of optimal fetal and child nutrition and development during the life course. So If we have good early child nutrition and development, we have adults that are healthier, more productive, that are more educated, and overall have higher income and better overall productivity and health. And then we have indicated where the different types of nutrition programs and interventions are. On the left side, we have a list of nutrition-specific interventions and programs that address the direct determinant of nutrition. So these include all of the maternal and early childhood nutrition intervention, disease prevention, hygiene, and all of the also interventions to treat severe acute malnutrition. On the right side, the green box, you have the nutrition-sensitive programs and approach, and I will define those in a minute. But you can see that these interventions address the underlying determinants of nutrition, so that is income, food security, interventions that target improvements in also maternal empowerment, maternal caregiving resources, as well as household and community level resources for care and feeding, and other interventions that address the lack of access that poor people sometimes have to health services, safe and hygiene environment. And finally, paper 4 deals with building an enabling environment, and here we have the purple box, which addresses the basic causes of nutrition, and that includes the policy, the politics, governance, capacity, financial resources, etc. So this is the area that we will talk about today, and this is what paper 3 covers. So in terms of definition of nutrition-specific interventions and programs was a little bit easier for us to define. Those are have been defined before. There are interventions and programs that address the immediate determinants of fetal and child nutrition and development. They include adequate food and nutrient intake, adequate feeding, caregiving, and parenting practices, and low burden of infectious diseases, the food, health, and care. And here is a list of different types and categories of interventions and programs that are of known efficacy to improve nutrition. And I've highlighted in red the aspects related to child development, responsive feeding practices, and stimulation are part of the nutrition-specific interventions and programs. And disease prevention is where the water and sanitation, the WASH interventions are in this broad categorization of direct nutrition intervention. So those are all, as I said, the interventions that aim at improving food and nutrient intake of young children, improving care and feeding practices, as well as early child development, parenting, and finally, the direct interventions to prevent and manage diseases. In terms of nutrition-sensitive interventions and programs, we define them as interventions and programs that address the underlying determinants of fetal and child nutrition and development. As I mentioned before, those include interventions aimed at improving food security and promoting adequate care resources at the maternal, household, and community levels, as well as interventions aimed at increasing access of poor people to health services and to a safe and hygienic environment. But not only do these programs, in order to be nutrition sensitive, not only do they have to address those underlying determinants of nutrition, but they also have to incorporate specific nutrition goals and nutrition actions. We had a large group of people involved in defining the term nutrition sensitive, including the 13 Lancet Series coordinators and an advisory group that was composed of several members of UN agencies, NGOs, and donor representatives. And we agreed that it is not enough for a program to be called nutrition sensitive if the program doesn't specifically incorporate nutrition goals as well as nutrition actions. So here we have at the bottom an example of what we mean by those kinds of programs. So programs in the area of agriculture and food security, programs in early child development, programs aimed at improving women's empowerment, nutrition in school programs, for example, health and family planning services. Social safety nets are also another type of program that has a lot of potential to be nutrition sensitive. Interventions aimed at improving maternal mental health, child protection, and finally, water, sanitation, and hygiene. Those are examples. There are other sectors, there are other types of interventions that could fit here. This was just providing example of interventions and programs that fit into our definition or can be made nutrition sensitive. So what we are seeing with these nutrition sensitive programs is that they can serve as delivery platforms for nutrition specific intervention. They can be programs that incorporate nutrition specific interventions and that help increase the scale of nutrition specific interventions, the coverage, and their effectiveness because they also address some of the very important underlying determinants of nutrition. In our particular paper, paper 3 of the series, we included programs for 4 different sectors: agriculture, social safety nets, early child development, and schooling. You probably immediately think, why is WASH not included in this paper? And there are several reasons. One that might seem a little bit lame, if you want, that we had a severe word count, word limit on the paper and could not cover everything. And this was the case for all of the different papers. And so we were constrained. And then we had a set of criteria that we selected, that we used to select those sectors. And I'll come back there and WASH fit in relation to these different criteria. So they had to be relevant for nutrition. So those all are, and of course water and sanitation is also relevant for nutrition. They had to have evaluations of nutritional impact available. Um, some of the sectors we covered didn't have much evidence from nutritional impact, but they had at least evaluations of nutritional impact. They had to have high coverage of the poor if possible, and they had to be programs that were either targeted to people and individuals and populations that are nutritionally vulnerable, or at least be that it would be a good thing to do or an easy thing to do to target them more effectively to nutritionally vulnerable groups. So if we look at the 4 sectors covered, agriculture and social safety nets really had met the 4 criteria, especially social safety net also met the criteria of high coverage. In some cases, agriculture, the small scale agriculture that we included in the program, in the paper, the homestead food production systems, the home garden, those do not, most of the time, do not achieve high coverage. But they had, of course, the other 3 criteria. Early child development does not meet the high coverage of the poor. This is not an area where we had several large effectiveness trials of early child development interventions, but it was important, so important and so relevant to nutrition that we decided to include it. And schooling did not meet some of the criteria, but again, this is a small section that we thought was important to highlight because maternal education is so strongly associated with child nutrition, parental education, but mother's education even more. And we think that there's a lot that could be done, a lot more that could be done to make schools more nutrition friendly. And then water and sanitation, we debated a lot, and for the longest time, it was supposed to be covered in paper 2 of the series in the nutrition-specific interventions. And at the end, it is not covered there either. At the end, it did not get covered in either paper 2 or paper 3. It is mentioned, its importance is recognized, but it is a sector that is not covered fully in the series. One of the reasons for us to not include it is that we did review the literature, and we found that there was really very little in terms of evidence of evaluations that looked at nutritional impact. The evaluations that we found looked mostly at diarrhea, infectious diseases, which is very relevant for nutrition. But we now know there is a Cochrane review that is showing that there's very little evidence of, or very few rigorous studies that have looked at the nutritional impact. So this is a gap, and we recognize it, and it doesn't mean that we underestimate the importance of WASH. I'll have to move a little bit faster. So in terms of early child development, the main reasons why we thought it was so important to include is that, first of all, we wanted to, in the whole series, we wanted to include evidence of interactions between nutrition and early child development. We know that stunting and poor cognitive and development share so many of the same risk factors, including nutritional deficiencies, intrauterine growth retardation, as well as social and economic conditions such as poverty and maternal depression. This was highlighted very nicely in the last 2 Lancet series on ECD. And we thought it was important to bring it in this paper so that we would look a little bit beyond what the other 2 series had done, but look at what are the interactions that we find, if any, or the complementarity between early child development and nutrition, looking at nutrition outcomes, because the previous series on ECD looked mostly on at the interaction between nutrition and early child development in terms of development outcomes. So we wanted to see if we could explore a little bit more that literature. And of course, the 2 stunting and poor cognitive development share the same period of peak vulnerability, the first 1,000 days. We know that for early child development and for cognitive development in general, there is the period of vulnerability is much longer than the first 1,000 days, continues way beyond the first 1,000 days, and might be reversible. Damages done in the first 1,000 days might be reversible to some effect, but the first 1,000 days is excessively important for both. So the key findings, when we looked at the literature and reviewed a lot of the same papers that had been reviewed in the previous series, and we added the papers that were published after the last ECD series in the Lancet, we find that the literature has mostly relatively small-scale programs, many of them that were targeted to at-risk children or severely malnourished or moderately malnourished children. And this literature does suggest at least additive effects, and in some cases synergistic effects of interventions combining nutrition and early child development interventions on child development outcomes as well as on nutrition outcomes. The evidence of the synergy, for example, between nutrition and ECD interventions is stronger for development outcomes than it is for nutrition outcomes. Few of the programs that, for example, also include only early child development interventions had a positive impact on nutrition outcomes. But when the 2 were combined, in some cases there was a greater impact on development outcomes and not on nutrition outcomes. And in other cases, you could see a synergy. And in the paper, we mentioned which of those studies did show a synergy and which didn't. From these results, and just from plain common sense, we conclude that it really does make sense to combine early child development and nutrition interventions, both from a biological perspective as well as a programmatic perspective. We can certainly gain in program efficiency and in hopefully in impact and in reducing costs if we combine interventions that if we, for example, piggyback on nutrition programs to incorporate early child development interventions, or the other way around. I just wanted to show, and you're not probably not able to read that. And what I wanted to show is that in the on the web of the Lancet, and this is the summary of the studies that we reviewed. There are many more pages to that. We reviewed, I think, a total of 10 different looked specifically at the interaction between ECD and nutrition interventions, and we summarized the findings and their conclusions. So that's just for your reference. I also wanted to just report very quickly on some new results that are not published yet, but that some researchers in my team have done, which is an example of a very interesting interaction that was found between early child development and nutrition. So the intervention was a cash transfer, comparing a cash transfer versus a food transfer to stimulate participation in ECD centers in a very, very poor rural area of northern Uganda. So contingent on participating in the ECD centers, parents would either receive cash or food. And what was found was an interesting result was that cash actually had a lot more impact in this particular context for a variety of reasons, because people were really poor and needed cash for a variety of purposes, but they also used the cash effectively to increase their food security, to increase children's diet quality. And this had an impact on reducing anemia, which is very, very severe in this region. The cash also, they used some of their cash to improve the quality of services in the centers, either to bring material or to give an incentive to the teachers in the centers. And with the cash, there was a greater attendance at the ECD center from children because they wanted to receive their cash, and therefore were more likely to send their children to the ECD centers. And so there was also an impact on cognitive and motor development. And you see at the bottom of the slide basically that the pathways that we hypothesize are responsible for the impact on child development multiple. First of all, food security was improved, children's diets were improved, and anemia was reduced. Anemia contributes to improving child development, but also the cash helped families motivate them to send their children to the ECD center and to be more stimulated, which directly can affect child development. And then parents' contribution had an impact on the quality of the services, which can in turn affect both reductions in anemia and improving child development, because part of the improvements in quality of services in some cases were improvements in terms of water availability and sanitation and cleaner facilities. So this is an example of a study that was done at larger scale in the context of a social protection program, integrating both nutrition and early child development into a social transfer kind of program, which aims at reducing poverty and food insecurity. So just to get back to the paper 3 very quickly, what we describe in the paper also are ways to make nutrition, to make programs more nutrition sensitive. And so we focus on various ways that programs in different sectors can be made more nutrition sensitive. And I don't want to spend much time on that. Mention that that some particular ways to do so are to improve, for example, the targeting and the timing and duration of exposure to the interventions. Many programs in those different sectors that we talk about are targeting the wrong age group. If they want to have an impact on nutrition and ECD, they should be targeting the first 1,000 days at least. And for ECD, they can continue to target preschool and children older. Other ways to improve the nutrition sensitivity is to use conditions like I just mentioned. If you use conditions to improve, to increase the use of the services and the demand of the services, you may have a greater impact on your outcomes, especially nutrition and health outcomes or early child development outcomes, if those are part of the goal. To improve the nutrition sensitivity, also you have to strengthen the nutrition goals, the design, the implementation what we find in our review is that a lot of programs had nutrition goals, but they didn't necessarily have much in terms of an intervention, a nutrition intervention. So you couldn't expect so much impact at the end of the day. It's not enough just to have a nutrition goal. You really need to have a specific intervention. And of course, focusing on women is one way to achieve greater impacts on nutrition and early child development, and addressing physical and mental health and empowerment constraints in women is absolutely key to making programs more nutrition sensitive. Just quickly, I wanted to also mention that we have also reviewed, and others have done that too, where we are, what is ongoing in terms of nutrition sensitive programs, who's doing what are the new programs that are being set up. And we find that there is a new generation of very nicely designed nutrition sensitive programs that have clearer goals and actions, and that also address many other constraints to nutrition than just lack of food. And especially agriculture programs now are increasingly trying to integrate water and sanitation interventions, realizing the importance that WASH has for prevention of infections as well as to improve nutrition. There's also innovation in terms of addressing specifically maternal depression. There was a web seminar a few weeks ago on that, which I heard was very interesting. I couldn't participate, but there are ways not only to detect problems of maternal depression, but ways to intervene. And so there is a nice set of nutrition programs that are currently not only being implemented, but many of them are also being evaluated. So we expect in the next 5 to 10 years to have a much stronger body of evidence, and have a lot more ability to provide guidance for decision makers regarding investments in nutrition sensitive programs. So finally, some of the key messages which cover not only the nutrition and ECD, but the whole paper. What we found is that nutrition sensitive programs in agriculture, social safety nets, early child development, and education have enormous potential. There are many pathways of impact. They can definitely help improve nutrition, but this potential is yet to be unleashed. And once it is unleashed, we hope that it would enhance the scale, coverage, and effectiveness of nutrition-specific action. So combining nutrition-specific actions and integrating them in nutrition-sensitive programs, we certainly think is the future. Targeted agriculture programs and social safety nets are very promising because they do play an important role in mitigating the negative effects of shocks and global changes, as well as supporting livelihoods, improving food security, diet quality, and women's empowerment, and reaching nutritionally at-risk populations. So we shouldn't underestimate their potential to be platforms for delivering specific nutrition interventions and possibly early child development interventions as well. Incorporating nutrition in early child development programs and in school curricula, both nutrition, both in the short term as well as in the long term. And this is an important aspect of incorporating school nutrition in school programs that I haven't elaborated on here. But if we integrate more specific nutrition intervention in school programs, we can have benefit on the knowledge and practices and the creation of good habits in adolescent girls and boys, and prepare them better for their parenting roles in the future. So we that way may be able to influence the nutrition of future generations and nations. And finally, it is important to realize that nutrition sensitive programs play a very important role, because one thing I did not mention, but that when you read the second paper of the Lancet series, you see that if we scale up nutrition-specific interventions to 90% coverage, those interventions that we know are effective, it's a set of 10 interventions that are modeled in paper 2, we will reduce stunting by only, or prevent stunting in only 20% of children. So we really cannot do as much as we would like to do with nutrition sensitive programs, we need to do a lot more in order to be able to address nutrition faster and with bigger impact. So I'll leave it at this.
Marie, thank you so much for a great presentation. We're going to open it up now for to remind you that there are two ways you can ask a question. You can type into the question panel found on the right side of your screen, or you can raise your hand, and then you'll have a chance to ask a question using your microphone. We'll try to keep track of who is who's in line, in queue for those questions. So please start now to send in your questions or comments. I'm going to kick things off by asking Marie my own question. Marie, given your experience of reviewing the literature as you led the writing of the Lancet article, what is your take on the idea of a clean, fed, and nurtured approach to promoting child growth and development? That is, an approach in which WASH, nutrition, and early child development sectors work together.
I have tried to incorporate some of this in the presentation, but obviously the review of the literature highlights. Can you hear me?
Yes, thanks.
Oh, okay, because I can hear you. Yeah, so the review literature of programs in different sectors, especially agriculture, which is a sector on which a lot of people are relying on to improve nutrition. There's been a momentum with the last food price crisis that agriculture has woken up to the fact that it is an essential way to improve food security, and by improving food security, some people in the development world assume that nutrition will be improved automatically. Well, it is clear from our review of the literature that this is not the case. Because if you look at the macro level, if you look at countries and their investments in agriculture and the growth in agriculture sector, it has not necessarily led to major reductions in nutrition. And you can certainly see that in India, where there has been an active and very successful growth, economic growth, and some of it coming from agriculture, and very little improvement in nutrition over the past decade or so. Agriculture and economic growth can only take us thus far, and we know now that we need to do a lot more. And what we need to do also is not just to focus on nutrition. That's also something that we realize, that some programs that actually do focus on nutrition are not having the impacts expected. That is because there are other constraints to child growth. And one of the very big one that I'm very happy to see more momentum on that is the WASH sector. There is a lot of discussions right now about enteropathies, about open defecation, and the fact that if we do not clean the environment in which the children grow and develop, we will not be able to improve their nutrition and development at the scale that we hope to be able to do. So we definitely have all the supporting evidence that nutrition alone will not be enough, and that agriculture alone will not be enough either, and probably WASH alone wouldn't be enough either. So, they really need to all go together. And child development and nutrition are outcomes, but they have interventions related to achieving these outcomes, and they are the interventions in the child development sphere as well as the interventions in nutrition. And by integrating the nutrition, early child development, and WASH interventions, there really is a much greater hope to have positive impacts on infections, child development outcomes, as well as nutrition. So we need food, health, and care in order to improve nutrition, child development, and reduce infections.
Thanks, Marie, for that response. Let me turn to a question from Jordan Teague. At the final version of the series, WASH was included as a nutrition-sensitive intervention. You mentioned, however, that it was considered as a nutrition-specific intervention as well. How was it finally chosen to be nutrition-sensitive?
You are right. It was not chosen, and we do not need to choose really. In a way, it doesn't really matter if it's a nutrition sensitive or nutrition specific. I consider it both, yes, because certainly with the link with the direct link to infections and diarrhea in particular and enteropathy, this makes it a direct nutrition intervention. But to make it to discuss it in the context of nutrition sensitive interventions is to say that programs in the wash sector could be made more nutrition sensitive. That is, in addition to doing what they're doing, which is to bring clean water and help improve hygiene practices and sanitation practices and all of those things, not only could they reduce infections, diarrhea, and help clean the environment, but they could also include some behavior change or in other interventions to improve nutrition as well. So by default, they are nutrition specific, but we can, if we combine the wash and nutrition interventions, then they become nutrition sensitive because they incorporate some nutrition specific interventions. And the other way around too, nutrition programs could also be more wash sensitive or be more amenable to including, for example, the behavior change that we do for the essential nutrition actions do incorporate hygiene practices. So they are wash sensitive. So it's a pure interaction between the two. And I don't think what's important here is so much to separate what is nutrition sensitive and what nutrition specific. It's important only to make sure that people don't assume that they're doing something that's nutrition specific, or sorry, it is important to make sure people don't assume they're doing something nutrition sensitive because they have a nutrition goal. That's the most important part. This is not enough. As I said, you need to also have nutrition specific nutrition intervention. So a WASH program that includes hygiene related feeding or responsive feeding, but maintaining hygiene practices becomes a nutrition sensitive WASH intervention.
You explained that nutrition sensitive interventions can serve as delivery platforms for nutrition specific interventions. Do you have practical suggestions for how this may be done in the WASH sector?
Yes, I was hinting at that. In my response, the kinds of things that the kinds of interventions, for example, especially in the area of behavior change, is probably the most commonly done way of including nutrition-specific interventions in other sectors. So as I was mentioning, if you have your wash intervention and the wash intervention is focused on wash your hands with soap and all the good practices related to hand washing, for example. Well, you can link that to also at the same time talk about washing your hands in the context of preparing food, giving your child the right foods, well cleaned and safe to eat. So you can combine with some messaging on complementary feeding when you're actually focusing your program on hand washing. The same with incorporating breastfeeding promotion in a wash program. This is the cleanest way to feed your child for the first 6 months. So you're talking about preserving or protecting the health of the child, and in the context of a WASH program, that the safest and cleanest way to feed your child is breastfeeding. So you're combining messaging that's related to WASH as nutrition.
This one in from Parmi Suchdev. Clearly, integration is the way to go to achieve optimal nutrition in child growth and development. How can programs do this given vertical funding sources?
The question of how to integrate and the complexity of integrating, as well as the funding sources, as you mentioned, and Those are extremely important and relevant questions, and this is what we need to address now. Now that I think we have a momentum that people are interested and motivated in exploring more and better and new ways of improving nutrition by addressing some of the underlying causes, we're facing the problems of all very nice to recommend, but how do we do it? So you're touching on the issue of integration, which at the program level is already a very challenging thing to do. We all know that we have workers that are health workers or ag workers or other extension volunteers or staff that are already overwhelmed with what they have to do. And now we say, oh, but they need to do a lot more. They need to start, integrating all of these other actions from other sectors. And so we know there might be a severe bottleneck in terms of capacity as well as feasibility of integration. And then you mentioned the funding mechanism. What I have been very happy to hear, though, is USAID as well as I think DFID now have announced that they will invest in nutrition sensitive programs. So I think at the donor level, people are starting to reach out. It's taken a really long time, but with the Sun Initiative movement, um, we have heard over and over about the importance of working multi-sectoral, and I think donors are very much involved in the Sun and are starting to move away from their own silos. It's taken a long time. I remember discussing with the Gates Foundation, maybe 7, 8 years ago about agriculture and nutrition and or health, agriculture, nutrition, and health, and they were saying exactly that they were not even talking to each other within the foundation, and at that time, or certainly did not know how to work together yet. But I think donors are increasingly motivated to do that, and some of them are specifically assigning people to work on this integration. The other point on that I'd like to make is the fact that we talk a lot about integration, and we have to do research on that to understand the constraints and the feasibility and all those aspects. But there is also another way that we can do things, which is to co-locate. And this is definitely a research area that I would like to pursue, is to look at whether we really need the different sectors to integrate and agonize over how to integrate and integrate effectively, versus is it enough to co-locate all of the different interventions that we need to see happen in this target population on those vulnerable children? And I think it's worth, in some cases, trying both and seeing if we get the same results. There is integration. Obviously, everybody has to have a common goal, but do they have to have a common implementation plan is not clear to me. And so it may be that there is quite a bit of important research and learning that needs to be done on integrating versus co-locating, and where is it absolutely necessary to integrate, and where can we achieve similar results by just targeting the same children and the same communities with the everything that they need.
Thank you. This in from Aaron Buchsbaum. Marie, thank you so much. We were curious about your comment on needing to improve, for example, targeting, timing, and duration in nutrition-sensitive interventions. Do you have any examples that stand out in your mind of projects or initiatives that have begun incorporating or changing their approach based on the Lancet Ag Nutrition and similar research, or of initiatives getting underway that incorporate successful targeting design elements?
This is a great question. We have a lot of examples of programs that were evaluated, for example, in the area of conditional cash transfers, as well as agriculture. Well, let's take agriculture. Agriculture, very often, programs are targeted at the community level, which makes sense from a production point of view, an agricultural production point of view, and also from an ethical point of view, or just to also, yeah, the logistical point of view, you target a community and you introduce an agriculture intervention and you don't force people to participate. Usually people are welcome to participate. And then someone comes and says, well, we want to evaluate the program, and the evaluation looks at the population that was, takes a random sample, let's say, of the population that was targeted and reached with the intervention. And most of the families that are actually being evaluated don't have children in the first 2 years of life. They may have, or you know, you have a very small sample of children that were exposed when they were during the 1,000-day period, which we know is the period. If you miss that period, you're not going to have so much impact on nutrition as if you target that period. And so programs document that they didn't have any impact on nutrition. And you look at what age group they had included in their evaluation, and you say, no wonder they didn't have impact. The kids are too old. They were not exposed during the right period. And so that is not an evidence of lack of impact. It's a program that was not evaluated in the right age range to actually be able to demonstrate an impact, and especially on linear growth, on stunting. We know that after 2 years of age, if you start a program when the child is after 2 years of age, this child has much, much less possibility to improve in terms of stunting or linear growth than a child that is targeted from life in utero until he or she is 2 years of age. So not only is it important to target the right age group, but the kids also have to be in the program for long enough to benefit. So that's why we're saying that the timing of the targeting and the duration of exposure is really important. What we find now increasingly is that programs are trying to target the 1,000 days. I've been involved in agriculture programs as well as food aid programs that are specifically targeting the 1,000 days. So they recruit based on women, families having women being pregnant or lactating and having children under the age of 2, and very often they limit the age to say under the age of even 3 or 6 months when they come in the program, so that they're exposed for long enough to have an impact. There are concerns related to that when you target women who are pregnant, lactating, and those that have young children. There are concerns that it might increase fertility. It might motivate mothers to become pregnant because they want to be in the program. But there are also ways to prevent that from happening by, for example, targeting the whole population. But for the families that do have a child that is at the right age and a mother that when the mothers become pregnant and lactating, they receive an additional nutrition package specific to their needs during the 1,000 days. So that's one way. If you only restrict the participation in the program, especially cash transfers, for example, to women that are pregnant, then yes, it could be that women decided to become pregnant now as opposed to later, or decide to have one more child just to participate in the program. But if you have just a specific package of nutrition, education, and nutrition inputs for those that have children in the right age, then you're probably able to avoid having the increased fertility problem.
Thanks so much, Marie. I wanted to remind people that this webinar is being recorded, so you'll be able to access it later. And I have the final question from Jill McFerrin Aviles. She says, congratulations on bringing increased attention to the synergistic effect of nutrition, child development, and WASH. I agree that a holistic intervention will achieve increased impact on children's health, nutrition, and development. My concern is how to break the silos. Not only how to bring nutrition into child development, but also bringing child development into nutrition and WASH. What are your thoughts on the challenges and some of ways to break down those silos?
Again, a great question for which I do not have a full answer, really. But I have to say that this initiative in itself is, the Clean Fed and Nurtured initiative is an excellent way to start. I also mentioned that the Sun movement, I think, has done a lot over the years of its existence to bring people from different sectors together. Yes, sometimes it's much more the nutritionists talking about how can we reach out even to health, and reach out better to the ECD and to the WASH people. Um, but this is a very good start, and I think what I liked of the community of practice, that the clean fed and nurtured, is that the first event that was organized really did exactly that. They brought together people from the three different sectors, if we can call them a sector, and reading, I wasn't a part of this first meeting, but reading the report from that first meeting, it was interesting to see that the different sectors, the people from the different sectors were saying they were not so well aware of the nature of the evidence for the other sectors. For example, the nutritionists probably didn't not all know that in the WASH sector, the evidence of impact of WASH on diarrhea and infectious diseases is quite strong, but it is not strong on the evidence of impact on nutrition outcomes. And the same for the ECD people might not have known as well what the evidence is in terms of the WASH intervention. So we need to bring people together at all levels, bring policymakers from the different sectors together, bringing researchers from the different sectors so that they start working together and learning from each other. And then the practitioners, and I think of all people, probably the practitioners are those that have been more exposed to each other, because in the field, people actually do interact and very often target programs in the same area and see each other. But the researchers don't interact much. We don't read the same literature. We're not exposed to the same things. And certainly the government people and the policymakers. And there have been some attempts at bringing, for example, representatives of different ministries in the same room to discuss. And I think in agriculture and nutrition, for example, we have quite a bit of expertise now in bringing these people together, in having rooms where half of the people are nutritionists and the other half are agriculture people, or some are health, nutrition, agriculture. But it takes a long time. I'm actually very optimistic that this will be happening in the next 5 to 10 years, not by miracle, but just because so many people are committed. And I think the excellent work of a few people in the WASH sector recently, and the scare we have about the enteropathy, as well as the papers about open defecation, all of those things are really making everybody, even people that you would not expect would be so aware of the importance of WASH, are starting to put that in their presentations and talk about it and recognize the importance. So no magic recipe to bring people together, but I think just continued effort of this kind to spread the word of the importance of doing at least all three of those things if we want to improve child nutrition and as well as early child development outcomes at scale.
Thank you so much, Marie. A
Yes.
recording of this webinar will be available at a future date. Each of you who signed up for today's webinar will receive an email from us with a survey, so you can give us your feedback on today's session. Through that survey, we also will offer the opportunity to sign up for email notices about future clean fed and nurtured events. The report that Marie mentioned on our first meeting is available through, let's see, you're looking here at, I guess we don't have that URL, but you can get to it through the LinkedIn group. So please join us up there under Clean Fed and Nurtured. We have a page and you can access all the reports and slides and everything from that first meeting. For those of you new to Clean Fed and Nurtured, these are some of the other ways you can reach us. We have a Facebook page, which is not too active right now, but feel free to post on it. We're on Twitter at Thriving Baby, and you can use the hashtag CleanFedNurtured. We want to thank all of you, and especially Marie Ruel, for sharing with us today, and we look forward to hearing from you in the future. Thank you.